We just came out of your presentation where you've been discussing a new agent, Anamorelin,
Yes.
and this is in treatment for cancer patients with anorexia and cachexia,
Yes.
and this is non-small cell lung cancer. First of all, give me a brief background as to what you've been looking at here.
Absolutely. So anorexia and cachexia is a huge problem in patients with non-small cell lung cancer, especially those with advanced disease. Both from the underlying cancer themselves and the treatment that we give them, patients tend to lose their appetite, eat less, and then they also lose some of their muscle mass, which can make them feel weak and tired. And as I mentioned, it probably interferes with their ability to get treatment.
Yeah, so what was the study protocol here? What have you been looking into?
Excellent. So the study enrolled a large number of patients with advanced non-small cell lung cancer and randomized them to a placebo or the Anamorelin pill. And the primary goal of the study was to show that patients who received Anamorelin had an increase in their lean body mass. And basically, lean body mass is another word for muscle or skeletal muscle mass.
So you've seen a positive impact here. What kind of follow-up have you been looking at, though?
So in this study, patients had their lean body mass assessed at 12 weeks, and then the study ended. Doing the lean body mass assessment is a little bit of a procedure. The test is a little bit complex, so we try to minimize the burden on the patients, especially in light of the fact that they mostly had incurable disease.
And what about side effects, though? Has it been well tolerated, this new agent?
Yeah, I think that's one of the most exciting parts of the study, is that not only was the drug effective, but it was actually incredibly well tolerated, and that the overwhelming majority of patients didn't have any side effects at all.
Is this still too early to potentially be rolling this out? The data looks quite encouraging, but
Yes.
it is still quite at an early stage, isn't it?
I think probably this data is compelling enough that it's time to start talking to, at least in the United States, to our FDA about considering drug approval.
It's fantastic. So
Yeah.
what have your overall conclusions been then coming out of these findings?
I think the study results are incredibly exciting, that we finally have an effective, well-tolerated, and safe drug for treatment of anorexia and cachexia.
So what would your main take-home message be then for the practicing community at this point?
I think they should keep their eyes open for the FDA approval, and hopefully it gets FDA approved soon and they can start prescribing it to their patients.
So what other therapies were these patients receiving, and did that potentially have an impact on the benefits that you saw?
That's an excellent question. You know, because this was what we call a supportive care study, it wasn't focused on treating the patient's cancer, it was focused on quality of life and helping their symptoms. Patients with a wide variety of treatments were eligible to participate, and that's great with respect to getting lots of people on the study, but it does make it a little bit difficult to sort of look at exactly what chemotherapy patients are receiving. We do know that the majority of patients who participated in the study were getting their first line of chemotherapy for their metastatic disease.
And it's sounding encouraging then from what we've heard today, but what about availability of this Anamorelin?
Yeah, I think this is really, these two large phase 3 studies, the sort of goal of the studies was to show that the drug was efficacious and worked, and now we will go to the FDA and see if they feel that the data is compelling enough to approve the drug, or if we need to do more research.
So in a nutshell, for me, summarize your findings.
Yes, so very excitingly, Anamorelin did have a positive impact on patients with advanced non-small cell lung cancer. It improved their appetite and improved their lean body mass, which are two very concerning features in patients with this disease. So I really think this drug has the ability to revolutionize the care of these patients.